could a co-op actually drive costs down and provide comprehensive quality health care for all compared to the public option?
Well, that's a great question, and the proposal for a co-op, Senator Tim Conrad has come up with this idea, and essentially what he's offered it as is, we've got a circumstance in the Senate where I believe I'm accurate that all 40 Republicans have said they will not support public option. So, Senator Conrad understandably has said, that may mean that we can't get the 60 votes that we need. We may not have all Democrats supporting the public option, and therefore we should see if there's an alternative, and he came up with this idea of looking at co-ops. Now, co-op, the proposal he has that we're discussing in the Finance Committee would be that the Secretary of Health and Human Services would be given $6 billion and would be told that that is to be made available to provide, again, just like in the case of the so-called public option, on a loan basis, so that co-ops that wanted to establish themselves and begin selling health care insurance could have the necessary reserves to begin operating. And that would be the co-op. Now, co-ops, the board of directors of a co-op would be appointed or would be elected by the members of the co-op. And that would be a distinction between the co-op and the so-called public option. In the case of the public option that we have in the Health and Education Committee bill, the Secretary appoints the board of directors. My preference would be to do the public option that we've got in the Health and Education Committee bill, because I think the Secretary would then have an ongoing responsibility and accountability for how the nonprofit operated. But I could see a circumstance where co-ops could operate efficiently, and at least in the discussions that I've heard, that they could operate locally, they could operate on a statewide basis, they could operate regionally, they could operate nationally. And they could essentially go into the health insurance business just as any other entity would go into the health insurance business. Now, it's not as good a solution in my view, because once established, the co-op would be much less subject to any kind of control or direction as to the policies it would pursue. But some of that could be circumscribed to the way you set it up.
Thank you, sir. Our next question is going to come from Group 3, and I believe that it's Christine Suozzi who's going to offer this question on public health functions.
Thank you, Senator Heather. Our question is, how will the bill that you support adequate public health functions and infrastructure and community-based prevention? Not healthcare prevention, but real community-based prevention.
Well, that's not the main thrust of the bill. The main thrust of the bill is to try to fix some of the major problems in our healthcare delivery system, and not turn it into a public health bill. But there are various provisions in there that relate to public health. Where we are, one of the earlier comments was related to the workforce, healthcare workforce, and we have provisions in there to put more money into graduate training of physicians, to put more money into training nurses, to do a variety of things to provide additional incentives for physicians and nurses and other healthcare providers to locate in areas of highest need. Those kinds of things are in there. And that's not directly what you're talking about. But as I say, this bill is not intended to be a public health bill the way it's currently configured.
Thank you, sir. All right, we're going to go to Group 4, and I don't know who of you is asking the question, so please introduce yourself when you stand. Thank you.
Senator Bingaman, my name is Linda Allison, and I come from Group 4. We did have some differences in our discussion, but our concern is that the proposed health care legislation seems to be measured in dollars. versus human rights and human life. Do you believe that health care is a human right? And what are you doing to support a bill that acknowledges health care as a basic human right?
Well, I do think, having access to decent and affordable health care is a human right. The bill is intended to do that. It's intended to dramatically improve access to quality, affordable health care for all Americans. That's the whole thrust of the legislation. The idea of providing coverage to the 40-some-odd million people in this country who have no coverage today is clearly that. You're exactly right, though, in the premise of your question there. We are focused on the dollars, and we are focused on how do we expand coverage, but at the same time reduce the growth in healthcare costs going forward. Because we're persuaded, I'm persuaded at least, that unless we can begin to rein in the growth in healthcare costs, we're on an unsustainable course, and we're just not going to be able. You've got sort of a very negative feedback loop going on here. The fewer people that have coverage, the higher the premiums for those that do have coverage. And the higher premiums that you get for folks who do have coverage, the fewer people who have coverage. So we've got to break that cycle and expand coverage and begin bringing down premiums and seeing to it that they don't grow at the rate they can grow.
Thank you, sir.